We've covered a lot of material in sections 1 and 2, so let's move on to section 3 with the behavioral interventions. In this section, we're going to cover the cognitive triangle, the behavioral interventions, including behavioral activation, opposite action, courage ladder, positive imagery and visualization, deep breathing with visualization, and coping cards. Before we talk about the actual interventions, I want to explain the most important concept that we're going to discuss today, and that is the cognitive triangle, which essentially illustrates the connection between thoughts, moods, and behaviors. So if anyone out there has been sleeping, you got to wake up now. This is something you really have to kind of understand to understand how these interventions work and to understand how best to help your patient. So what I want to do is show you this cognitive triangle. So what you'll notice is that there are feelings, which is basically, someone's mood states or affective states. There are thoughts on another corner, which is basically what you're telling yourself and how you perceive the world. And then there are behaviors, which is sort of what you're doing every day. So what happens is I think of it as emotions have behaviors that go with it. So when people are depressed, they isolate. That's just what they do. Usually when someone's depressed, they feel fatigued, they feel like they don't have the energy, and so they kind of withdraw. It's almost like they feel like they can't engage. They don't have the energy to engage, so they withdraw. The other thing that happens when someone's depressed is their thoughts are negative. So reality is out here, and the way they're perceiving reality, it's almost like reality goes through a black filter, and good information gets filtered out. They're only bringing in the bad stuff. So their thoughts are negative. So you have depressed mood, negative thoughts, and isolation. So when people are depressed, they're pulling away. And because they're pulling away, they're isolated, they're not doing the activities they like to do, they're not socializing or engaging, guess what? They have more time to think, right? So they're in their head. It's almost like they're trying to figure out why they feel so bad. But the more they think and the more they're in their head, because their thoughts are negative, it's not helping their depression get better. It's actually making it worse. So they get more depressed. And then they pull away and isolate more, right? Which gives them more time to think, right? And their thoughts are negative, so they're getting more depressed, and they're isolating more, and their thoughts are negative. And this is what happens. They kind of spiral down. So, and before you know it, they're really in a pit. And this is kind of how depression works. It's important for you to understand this concept, and it's important for the patients to understand this concept. And with patients, when you explain this concept to them, almost universally, they'll say, oh, that's definitely me. Just put my name right there in the middle of the triangle because that's me. It's really critical to explain this to patients so that they understand that their personalities haven't changed. They haven't become a different person. It's just that they're depressed, and that's what happens. So that's the psychoeducation piece that we're going to talk about. STI is very heavy on psychoeducation, meaning explaining to patients so they understand. So that is the cognitive triangle. So let's talk about the specific behavioral interventions that you can use with your patients. So remember, if we look at the cognitive triangle again, what we notice is that essentially if you change one element of this triangle, that the whole thing changes. So if we change the behaviors, then by definition the thoughts and the moods are going to change, right? So with the behavioral interventions, what we're going to do is we're going to work on changing the behavior, which when we change the behavior, the moods will change and the thoughts will change. So with the behavioral interventions, they're interventions which are basically helping patients to change what they're doing in a moment-to-moment way. And when the behavior changes again, the thoughts and the feelings will change. So let's talk about the goals of the behavioral interventions. Basically, the goals of the behavioral interventions are to decrease the amount of time that the patient is spending alone. Remember, if they're alone in their thoughts, they're probably ruminating and thinking, and their thoughts are negative, so it's likely making the depression worse. So we're going to decrease the time that the patient's ruminating and in their head. The other thing we want to do with these behavioral interventions are we want to increase the amount of time the patient spends in pleasurable activities. When patients are depressed, they don't feel like doing anything anymore, and most of the time they've dropped activities that they used to enjoy doing. So we want to get them back doing those activities. We also want to help them start to do activities that are goal-directed. Essentially anything that's helping them to prevent rumination. Anything in which they're ruminating less is good. So again, increasing social contact, decreasing the amount of time that they're spending in their head thinking. The first behavioral intervention we're going to discuss is called behavioral activation. And with behavioral activation, basically what you're trying to do is to help the patient get back into the world. Because remember, they've been isolating, they haven't been socializing, they haven't been doing the activities they've liked to do. They probably haven't been doing activities they need to be doing, like paying bills and returning phone calls. So what you're doing with behavioral activation is you're helping the patient to plan activities so that they isolate less, they're thinking less, they're feeling dead time during the day, so they have more kind of structured time throughout the day, and they're decreasing the amount of time that they're thinking. And to do that, there's sort of a process with that. And here's the process of behavioral activation. The first thing you want to do is you want to provide psychoeducation. And with that, you want the patient to understand the thought, behavior, mood connection, so that they understand that the depression is not their bad personality. It's just that they're going through a difficult time. And it also will help them understand why you're going to help them to change their schedule. The next thing you want to do is normalize it, which really happens as part of psychoeducation. Once the patient understands that the process that they're going through, their negative thoughts, their isolation, is not their personality, they start to have less shame about it, and they start to understand that it's really the depression talking. Then the next step is you'll want to help them to do the specific steps involved in behavioral activation, which is essentially to find out what are they doing currently? How can they fill that dead time? How can they start doing activities that are more goal-directed and that are pleasurable? And then the last step is homework. And with homework, it's basically assigning them a task to go and to start doing the new schedule that you've created with them. An important concept for patients to understand when you're helping them to do behavioral activation is it's very critical that the patient understand the concept of opposite action. And that is, remember, when someone is really going through a difficult time, they don't feel like doing anything. There's a reason that they're isolated and they're not engaged. It's because they don't feel like engaging and they don't feel like being around other people. So it's very critical when you're helping them to come up with a new schedule with these activities. It's very important that they understand the concept of behavioral or opposite action. And the concept of opposite action is to basically do the opposite of how you feel. With the psychoeducation, I help patients see that the depression's sort of telling them to pull away, that the depression is causing them to isolate. So what they want to do is the opposite of how they feel. What they're doing is not working, right? They're going with what the depression's telling them to do, which is isolating, which is actually making them think more and get more depressed. So what I suggest to them is, let's try something different. Remember when I said earlier that STI is experimental? Saying to the patient, look, what you're doing is not working right now, so let's try something different. Let's try a new schedule, and remember that you want to do the opposite of how you feel. You're not going to feel like implementing a new schedule. You're going to feel like being in bed and not returning phone calls and not going to work. I want you to do the opposite of that, to experiment and try it, to do the opposite of what the depression's telling you to do. So I think what would be helpful is for you to see behavioral activation in action. So remember Sam, the 75-year-old man who had a heart attack and he basically doesn't get out of bed anymore. He's the home care patient. So I want you to see how I do behavioral activation with Sam. His targeted symptom is social isolation. And here is Sam. So Sam, tell me a little bit about your day-to-day activities.
Well, I mean, what you see is pretty much it. There's a bed over there, and there's TV over there, and that's about it.
So you basically watch TV all day?
Pretty much.
Kind of lay in bed?
Yeah. I mean, I get up and eat breakfast. But
okay.
That's about it.
Well, no wonder you're depressed. You're sitting around all day watching bad TV. I think I'd be depressed too if I were.
Well, I suppose, yeah.
Okay.
Yeah.
I want to explain something to you and show you something that I think you'll find really interesting. And it'll kind of help you understand what's going on. So, moods, thoughts, and behaviors are all interconnected. Okay? So, recently you've been feeling sad, would you say? Kind of depressed?
Mm-hmm.
Okay. When people are sad and depressed, you know what they do? What behavior? They isolate. They basically pull away from everyone because they don't have a lot of energy and they're not feeling good and they feel like they need to conserve their energy.
Mm-hmm.
And they can't really, they don't want to be around other people, so they isolate. The other thing people do when they're kind of feeling depressed or bummed out is they start thinking pretty negatively.
Mm-hmm.
Have you noticed that?
Yeah, I have. That's interesting.
What have your thoughts been like lately?
Well, yeah, I think of the past. I think of things I used to do. I think of friends that I haven't gotten together with.
Uh-huh.
I think a lot about this, not doing anything about it. It's part of the problem.
Right.
Sort of like,
yeah,
that your diagram.
Right. So if you're kind of sitting around watching TV, not really talking to anyone, not really leaving your house, not doing much, you probably have a lot of time to think. And again, when people are going through a rough patch, they're usually trying to understand why they're feeling so bad. So a lot of times what happens is we start thinking about bad things that happened in the past and sort of trying to understand why you're not feeling good. So, and then usually feeling like this is never going to get better. So usually the thoughts are pretty negative. And so if you're not doing much and you're isolated, you have a lot of time to sit around and think. How do you think that makes you feel? Do you think that makes you feel less depressed or more depressed?
Much more depressed.
Yeah.
Yeah.
So what happens is you're depressed, you pull away, you isolate, you have more time to kind of think about everything. And again, they're not positive, happy thoughts. They're usually pretty negative thoughts, which makes you more depressed, which makes you want to isolate more, and you kind of start spiraling. And then you get to a point where you're in bed all day and you don't get up.
Pretty much it.
Right? Yeah.
Yeah.
So the key thing, though, once you kind of understand this, it's really good to know, because a lot of times when people are going through a difficult space, they feel like their personality's changed. So once you understand that this happens to everyone, it's not you. We can actually get you better. And do you see how they're all connected? So if your moods, your thoughts, and your behaviors are connected, if we change one of these, then we change all of them.
Yeah, I can see that.
Yeah. So I was thinking about with you, what we could do is really work on changing some of the behaviors, some of the things that you do all day. You know how you're isolating, you don't leave your house? Yeah. So if we work on changing that, you'll probably start, noticing that your mood gets a little better and your thoughts, are a little less negative.
All right. Sounds like a good idea.
Yeah. So let's kind of go through your day a little bit, and maybe what we'll do is create like a new schedule for you to try out. And I know that you haven't been feeling like doing this. I know you haven't been feeling like going out into the world and being with your friends. You've been feeling like being at home and isolating. But we're going to try something different. So tell me about your day-to-day schedule now. Like what time do you go to bed at night?
About 11.
11? Okay. Yeah. And then, and I'm just going to take some notes here. And then what time do you wake up in the morning?
10:30, 11.
10:30, 11? Okay. So you're sleeping 12 hours.
Yeah.
Okay. Do you always sleep that much? That's a lot of sleep for an adult.
Well, since I came home from the hospital, yeah.
Okay.
Yeah.
A lot of times when people are depressed, they tend to oversleep to kind of avoid life in a way.
Mm.
So, again, because when people are not doing well, they tend to want to, isolate and kind of be by themselves. So, being in bed is a cozy place to be. So, so I'm wondering if some of this sleep is a function of you being depressed, that you might not need that much sleep. So we can think about that with your new schedule. But so you get up at 11 and then what do you do?
I might eat a little breakfast. And go back to bed, watch TV.
Okay. And that's kind of your day?
Pretty much.
Pretty much, okay.
Yeah, yeah.
What did you used to enjoy doing? What did your life used to look like?
Oh. Well, I used to enjoy long walks, especially down near the beach. And, oh, yeah, I go bowling with some of my high school buddies.
Okay.
Good books.
Okay, reading. Okay, so you had quite a few activities. Why aren't you doing that anymore? Why aren't you going on walks or reading or bowling? What's stopping you now?
I don't feel like it.
Okay.
I don't know.
Yeah.
I just don't know why I don't feel like it.
Well, I think you don't feel like it. I think that's the depression talking. I think you don't feel like it because you've been depressed. So I want to explain something to you that I think is important. What's working, or your situation that you're in right now, what you're doing is not working. Would you agree?
Oh, yeah.
That kind of laying around the house and watching TV, you're just getting more depressed. So what I'm going to propose we do is create a new schedule for yourself starting tomorrow. And a very important part of that, or concept that I want you to know, is I want you to start doing the opposite of how you feel. Okay? The opposite. Because right now you want to be at home in bed isolating. We kind of have to do the opposite of how we feel.
You want me to do the opposite of how I feel? Okay.
Meaning, you know how you want to be by yourself and not really do much? We want you to kind of do the opposite of that. We actually want you to be out in the world and doing things, even though you don't feel like it.
Okay.
Even though you don't feel like it. Because we need to change this dynamic. We need to change this, because right now you're kind of spiraling, you're going downhill. We need to change this up. And in order to change it up, we have to start doing the opposite of what we're doing right now. Okay?
Okay.
So I just want you to keep that in mind as we move forward. So if we were going to create a new schedule for you tomorrow, let's say you go to bed at 10:30, 11, what would be a realistic time for you to wake up in the morning?
Well,
where you're not oversleeping, but you have enough rest. And I'm going to write down our new schedule in here. What's a good time for you to get up?
Well, I used to get up around 7:30, 8 in the morning, something like that.
You want to try that?
Give it a try.
Okay. So I'm going to have us getting up at 7:38. What would you like to do after that? Again, doing something new, trying a new schedule.
Well, I used to enjoy long walks.
Okay. Could you go on a walk?
We'll give it a try.
Okay.
Yeah.
What would stop you from going on a walk tomorrow? If we decided we were going to try something different, what would stop you from doing that?
Well, assuming that I set my alarm, and I assume I do get up, I can't think of anything that would stop me from doing it. Okay. Okay, so we're going to go on a walk. What would you like to do after that? Well, seems like I should come home, take a shower, and maybe have some breakfast. Okay. Yeah. And then after breakfast, what would be good for you to do? I don't know. I used to go to the senior center. That's a good idea. Yeah. I used to play cards. Okay. So you could go to the senior center like for lunch and cards? I used to do that. Okay. Yeah. Here's the thing I want you to keep in mind. The goal here is to get you out doing things. Mm-hmm. It's to kind of get you out of your head, because your head's not a good place right now. Okay, so we want you out in the world, out with friends, out doing things.
not home watching TV all day. Remember, with the snooze schedule.
Okay.
So maybe go to the senior center. Are there any other things you might like to do?
I can't think of anything right now.
Well, another thing I want you to consider is sometimes when people are depressed, they kind of avoid doing things that they kind of need to do, like laundry and paying bills and returning phone calls. And I don't want you to get overwhelmed, but you might think about doing one or two of those little activities, even, folding laundry, just so that there's a sense of accomplishment that you're doing something, that you're kind of moving forward.
To-do list.
Okay.
Yeah, I could do that.
All right.
Yeah. I could put one of those together.
Yeah, maybe just a couple things. I don't want to overwhelm you, but I do want you to get a little bit out of your comfort zone. Remember, because you doing what you feel like doing right now, we're kind of not in a good space. So again, we're going to do the opposite of how we feel, and a little out of your comfort zone is okay. And so here's my idea. I think I'm going to give you this. I have this STI patient handbook. Mm-hmm. I wrote down your new schedule. I'm going to have a couple things in here, mark a couple pages that I'd like you to read on kind of the opposite action and sort of creating a new schedule. Mm-hmm. I want you to read those, and I want you to kind of implement this new schedule, and then I'm going to come back next week and we'll see how you're doing. Okay?
Okay.
And if you're not doing better, we'll figure something else out. Okay? We'll get you better. Right. We'll help you feel less isolated.
All right.
Okay?
Well, thank you.
You feeling better?
I'm thinking better.
Okay. Okay.
I'm willing to try.
Okay. The next behavioral intervention I want to discuss with you is called the courage ladder. Remember earlier I was telling you how when patients are depressed, they often have a difficult time problem solving. They just can't break things down into little steps like they used to be able to do. So oftentimes it's important for the social worker or the clinician to help a patient create a courage ladder. They're unable to sort of break down a larger goal into little tiny pieces. With a courage ladder, the feeling is hopelessness, anxiety, and feeling overwhelmed. Usually the patient's thinking, I can't do this. And so the behavior is to avoid because they're really unable to break down the situation or the problem. The process for a courage ladder is to provide psychoeducation, again, to help them understand that when people are going through a difficult time, they often struggle to break a goal down into little pieces, to normalize that this is just what happens with everyone, and to explain the process, to actually sit down with the patient and help them take their goal and break it down into small, manageable parts. And then that becomes the homework, that you decide on how many steps of this courage ladder they're going to take. In the video, remember Sam? We've seen him a few times. We did the behavioral activation with him. And now you're going to see me use a courage ladder with Sam because he's unable to implement some parts of the behavioral activation program. So watch me work with Sam to create a courage ladder. Hey Sam, how are you doing?
Better. Yeah, I'm feeling a little bit better. You can see I shaved.
Uh-huh.
Yeah, I got out
Looks
of bed.
good, yeah. You look like you're feeling better.
Yeah, I've been getting up.
Okay, good for you.
Feeling a little better.
Going on walks and going to the senior center?
Well, honestly, I didn't make it to the senior center.
No?
No, I just couldn't
happened?
do that.
Yeah.
Well, I just felt, I don't know. I got in the car and I just couldn't start the car and go.
Yeah. So you just weren't comfortable.
A lot of people haven't been there in a long time, and I just haven't seen those people in a long time, and going by myself, I felt uneasy.
Okay. So what would make you feel more comfortable?
Well, if I went with someone, say my friend Frank, I could go with him. Mm-hmm. And then, I also need the sort of, my personal appearance. I've lost a lot of weight.
Right.
My pants don't fit me very, very well anymore. I feel kind of scruffy. I need a haircut.
Okay.
So if I sort of clean myself up a little bit and then have Frank help me out, I'd probably feel better.
So that might help you.
Yeah, I think
so. It sounds like you want to go to the senior center. It just sounds like what happened is it was too big a goal. That maybe, going to the senior center was too big and that we need to break it up into kind of little steps. With the end goal is that we get you to the senior center and we break it down into little steps. That happens a lot. And when people are depressed, things that used to be easy for them are a little more difficult and it's a little harder to problem solve. So why don't I want to write something out for you. There's a little something called a courage ladder, which basically you have a goal and you kind of work up to the goal. So if the goal is we want to get to the senior center, let's come up with a list of what we can do, little steps that you can take to get you there, to get to senior center. Okay, so what's the first thing? You were saying that to feel more comfortable, you'd like to go with Frank, maybe get a haircut, your pants. So what would be the first thing we could do?
Well, first thing, I think just my personal appearance. I'd like to get a haircut. I could call my daughter, and it'd be kind of fun to go shopping for some new pants with her.
Okay.
Yeah.
So call your daughter and then maybe go on an outing with her. So kind of schedule an outing to go buy new pants, right?
Yeah, I could do that first.
Okay, and get a haircut. Right?
Yeah.
Okay, so you'd have a new pair of pants, you have your haircut. How are you feeling at this point? You'd feel better, right?
Yes, I think, and then I could, I feel like I'm ready then to call Frank and see if we can
So
go
the
together.
next step would be to call Frank.
Yeah.
Okay. And then...
see if I can talk him into coming by and picking me up.
Oh, that's a good idea.
And then I don't have to get in the car and go alone.
Right, so you're socializing, but it kind of takes some of that burden off you. Okay. Call Frank and ask for a ride.
Yeah.
And then that might make you feel more comfortable, too, kind of going in with somebody since you haven't been there in a while. Okay. Anything else that you would need to kind of help you feel more comfortable going?
Well, I'd talk to Frank about this. We could hopefully pick a day where there wouldn't be a big crowd, where he and I could spend more time together with a lesser number of people.
Okay. Kind of doing some of the activities, but being less overwhelmed. With the quantity of people,
with a lot
right?
of people.
Okay.
Yeah.
How could you find out when there are less people at the senior center if you wanted that information?
Well, Frank might know.
Frank might know. And if Frank doesn't know, how could you get that information, would you say?
No, front desk would probably.
So you could call the senior center.
The senior center.
Okay.
Yeah.
So I'm going to put it down. Call the senior center to find out, like, when it's least busy, maybe. Okay. And maybe when they're doing the card games. I know you told me you like playing cards. Okay.
This is getting to be a long list.
I only have 6 things here. Does that seem too much? Is that overwhelming?
No, I can do those things.
Okay.
I can do those things.
Okay.
Yeah.
Well, here's what I think we should do. Why don't we try this? I'm going to see you next week. Why don't you take this and kind of see the progress you've made? So I have down on our list, we're going to call your daughter, you're going to schedule the outing to go buy the pants, you'll get your hair cut, call Frank, discuss the ride, and then call the senior center about the least busy, and then maybe pick a date. And then why don't you try this, and, I'm going to give you your patient handbook, and you can read a little bit more about courage ladders.
Okay.
And how to kind of implement them. And then I'll come back in a week and we'll see how you're doing.
Sounds great.
The next behavioral intervention I want to discuss is positive imagery or visualization, it's sometimes called. This intervention can be really helpful, especially for patients who are struggling with anxiety, who are struggling to relax, who are really angry and having negative thoughts or feeling hopeless. And what visualization is basically it's helping patients to be able to come up with an image when they're going through a difficult time. They can pull up an image in their head and kind of go to a relaxing, safe place that they imagine. And the role of the social worker or the clinician in this particular instance is to help the patient come up with this visual image. And it's to provide psychoeducation. So basically, the process for visualization is the same as it is with the other interventions, which is to provide psychoeducation. And that is, everybody needs times where they basically need to go into a different state temporarily to kind of decompress. They're struggling with anger or anxiety or whatever the symptom is, and they just need to kind of calm down and relax their central nervous system. And that is something we all do. The other thing with psychoeducation is helping the patient understand that visualization is something we do all the time. And you're going to see that in a couple minutes, how I bring that up with the next case. Normalizing is a big thing too, is helping the patient understand that we all need to be able to do this at times. It's nothing they need to feel ashamed of. And the specific steps are basically to help them come up with an image. So it's essentially asking them to figure out a time in which they were relaxed, seeing what they come up with. A lot of times the patient is unable to kind of come up with something, so you can make some suggestions and kind of collaborate to come up with a visual image that works well for them. It's best if you can use at least 3 senses, meaning sight, smell, visual image, tactile, so that they can really activate their imagination. I also use technology at times and will sometimes use like a video off YouTube to kind of help them get into that visualization, or I'll actually read a visualization exercise with them. And then for homework, I essentially will have them kind of practice using visualization at other times. So let's watch how I do this with Jim. Let's watch how I implement visualization with Jim. He is a 53-year-old man with colon cancer, and he's been non-compliant with his blood draws. So he was referred to the oncology social worker after he admitted feeling very anxious about getting his blood drawn. And the social worker basically discovered that he has a fear of needles. So his targeted symptom is anxiety. And watch how we use visualization with Jim. So Jim, I know that we've tried a couple different techniques to kind of help you with the needle stick, and they haven't really worked that well, but I had another thought. I was thinking that we could try visualization to see if that would help you with some of your anxiety with, getting the needle stick. What do you think about that? Have you heard of visualization?
I haven't heard about it, but I guess I'd be willing to give it a try. It does sound kind of out there, though.
Okay. Yeah, I could see why you think it sounds kind of out there. But visualization is something we all do all the time. Like if you're planning a special outing, usually sort of as you're thinking about it, like a visual image will come to mind and you'll sort of see the image in your mind. Has that ever happened to you?
Once in a while.
Yeah, like if you're planning a special trip and you're going somewhere, an image will come to mind. So it's kind of the same thing. Like we all do it all the time. We're just not aware that we do it. And visualization is actually, and positive imagery, it's a way to kind of help you relax. Like when you're in a moment and you're really anxious, because I think that's what happens to you. It's time for you to have the blood draw and you get really kind of anxious and nervous. And if you're using the visualization, it might help you kind of relax a little bit while they're doing the blood draw, So, we could try it.
I'd be willing to give it a try,
okay.
Definitely.
Okay. Yeah. So why don't we do this? My thought is why don't we kind of come up with an image right now and practice it so that aren't you coming back this week for another blood draw?
On Friday.
On Friday, okay. So why don't we come up with an image right now and practice it so that by the time Friday rolls around, when you're sitting in the chair, with the phlebotomist, you can kind of pull up this image and use it, and hopefully it'll help with your anxiety. Does that sound good?
Yeah.
Okay.
I'd like to know how to do that.
Okay. So why don't we just take a couple minutes right now? Why don't you kind of put your feet are in a good place, and put your kind of hands on your lap and kind of close your eyes. And take a couple, relaxing breaths. And now what I want you to do is I just want you to really close your eyes while you're doing this. I just want you to relax a little bit and take a couple breaths. Now what I want you to do is to think of a place that's really restful and relaxing for you. I want you to sort of imagine a place that you find really relaxing. And I want you to notice what you hear and what you smell. And notice what you see. Can you tell me the image that's coming to mind?
Well, I'm thinking of where I used to go on vacation as a kid, on Cape Cod and Wellfleet, down at the harbor.
Okay.
Looking at the boats.
Okay, so you're looking at the boats and you're walking around the harbor. I want you to sort of take a breath and imagine what it smells like down there. And notice sort of the warm sun on your shoulders. And notice what you hear in the background, if you hear children laughing or sort of, you know, boat horns, or notice what you're listening to. And then when you're feeling really relaxed, I want you to take a couple more deep breaths and just open your eyes.
Wow, I almost fell asleep. That was really relaxing.
Did it feel Did you actually see an image in your mind?
Yeah. Yeah.
Did you use all your senses? Like, you know, I mean, that for visualization to be most effective, it's best to incorporate as many of the 5 senses as you can. You know, did you, visualizing, what you see, what you hear, what you smell, what you might feel?
No smell, but definitely visualized and heard the sounds.
Okay. You might try tactile next time, like if you're walking on the shore, like, in the harbor, like what you feel on your feet or what you're holding in your hand. And it's funny because a lot of people will fall asleep when they're visualizing, so sometimes you might want to practice it when you're standing up because you don't want to necessarily fall asleep.
Okay.
But what if you were to practice it like maybe 2 or 3 times before you go to your appointment on Friday?
Well, it's a good idea because I'm definitely anxious about it.
Okay, good. So what I want you to do is on Friday when you go in, you sit down in the phlebotomist chair and I want you to do what we did, which is, you close your eyes and you just take some deep breaths and I want you to pull that image up in your mind and kind of let yourself even maybe take a stroll down, the harbor. Does that sound good?
Yeah, I can
I want to give you this patient handbook. And there's a section in here on visualization. I'd like you to kind of read a little bit more about visualization.
Thanks.
Okay?
Okay.
And then I'll see you in a couple weeks and we'll see how that worked. And if it didn't work, then we'll try something else.
Okay. Thanks a lot.
The next intervention I want to discuss with you is deep breathing with visualization. A lot of people tend to breathe with their chest, especially when they're anxious or agitated. They'll breathe like this through their chest and they don't breathe through their diaphragm, which means they're not getting in enough oxygen and they're not exhaling enough carbon dioxide. So it's really great for patients to teach them how to do deep diaphragmatic breathing. And you can add a visualization element because a lot of times with patients, you'll teach them the deep breathing, but what will happen is they'll find that they're bored because after a minute or something they get bored of it, so you can add a visualization element to it. And this just really, the deep breathing with visualization really triggers the parasympathetic nervous system. So here are the specific steps for the patient to take when you're trying to help them do deep breathing with visualization. Have them sit comfortably and put their hand on their abdomen. Usually I tell them to put their belly right, or their thumb right on their belly button. And then take a full exhalation, inhaling through their nose. And their hand should rise up when their belly rises up. And then exhale through their nose, pushing out as much breath as possible. And when you're doing deep diaphragmatic breathing, you'll notice that your hand will go up and down, up and down. To add the visualization element, you can have the patient inhale a color and exhale a color. So they could inhale blue, for example, and exhale pink. They could also inhale feelings or concepts, like they could inhale peace and exhale anger. Inhale love or exhale hate. Again, adding the visualization element helps them to maintain their attention so that they can just do the deep breathing for a longer time. This is good for symptoms of anger and anxiety and hopelessness and agitation. Watch how I show Jim how to do deep breathing with visualization. Remember, Jim is the 53-year-old man with colon cancer, and his targeted symptom is anxiety. So here is Jim. So Jim, how did the visualization work for the needle stick?
It worked pretty well. Worked pretty well with the needle.
Okay.
I'm still anxious, but the needle went well.
Okay, so you were able to do the needle stick, the visualization worked, but you're noticing that you're still really anxious?
Yeah.
Okay. Would you like me to teach you another sort of relaxation technique that you could use at any time that would kind of help you kind of lower your overall anxiety level?
Yeah, I'd be up for that.
Okay. I've found with different patients that actually kind of helping them learn how to breathe properly can actually be very relaxing. So why don't we kind of teach you how to breathe properly?
You have to learn how to breathe?
Well, not really. I mean, clearly you know how to breathe. But I'm wondering if I taught you this relaxation exercise and you could use it kind of multiple times during the day just to take a couple-minute break and kind of do some deep breathing, if that might help lower your overall anxiety level. Why don't we try it and sort of see how it goes? Is that all right?
Why not?
Okay. So why don't we practice it right now? Are you kind of in a relaxed position right now?
Yeah.
Kind of? Okay.
I'm okay.
So why don't you take your right or left hand? I don't know if you're right or left-handed.
Righty.
Okay, so take your right hand and put your thumb just sort of on your belly button. Okay, because what we're going to try and do is we're going to try and breathe through our belly. Most people breathe through their chest, and they especially do that when they get anxious. So the chest kind of go up and down like that, and then the oxygen doesn't kind of get into their system. So what we're trying to do is to get the maximum amount of oxygen into your system, which will help kind of relax you. Okay? So let's put our hand there. And if you want, you can close your eyes. I find it helpful to just, kind of take a couple minutes. And what I want you to do is basically breathe. And what we're trying to do is to have your right hand kind of move up with your belly. You kind of want your belly to move, to kind of blow out almost like a balloon. Imagine there's kind of a balloon and it's kind of going out and coming back in and contracting and constricting, okay? So if you notice that your hand is moving up and down, then you're doing it the right way. And usually what I do is I do about 15 breaths like this, and I find that that's very relaxing.
Kind of boring though.
Yeah, it's kind of boring. You know what, if you find that you get bored with deep breathing like this, what you could do is incorporate like a visualization element. So some people like to visualize colors, like visualize a color on the inhale and a different color on the exhale. Like some people inhale blue and exhale pink. Is there a color that is relaxing to you?
Not pink.
Okay. What would be a nice color to inhale? Like that would represent like peace or,
I like kind of like a bluish gray. How about that?
Okay, so what if we inhale kind of bluish gray? And what would you like to exhale? What color don't you like?
Well, don't like pink, so why don't I exhale pink?
Okay. So inhale, bluish gray, exhale pink. And literally imagine your sort of body kind of filling up with the bluish gray air and exhaling sort of the pink air. Inhaling, exhaling. Some people also find words or concepts are helpful, like they're inhaling peace and they're exhaling sort of hatred, or they're inhaling love and they're exhaling anger. And I think the reason it works is because it forces you to concentrate a little bit more. You know, when you're inhaling the colors, you sort of visually imagine The one color coming in and the other color coming out. How are you feeling with that? You still doing the colors?
Yeah, I'm still doing the colors.
Okay. What are you noticing?
It's pretty relaxing. It's pretty relaxing.
Okay. So why don't you open your eyes and then what'd you think?
Well, it helped. It helped.
Okay. Did you like the colors?
The colors work.
Okay.
The colors work for me.
Colors work better than the words like love or peace or, yeah?
Yeah.
Okay.
Yeah.
Okay. So what if you were to do that like a couple times a day in a structured way? Like the times that you notice that you're most anxious, literally take like 2 or 3 minutes and go do that breathing exercise with the color and the deep breathing. How would that, just to kind of lower your overall anxiety level?
That shouldn't be a problem.
Okay. And one thing I often tell people to do is to lie down on the ground and to breathe and to put their stomach on their hand. Because when you're lying on the ground, you can really get the sensation of breathing through your diaphragm. For some reason, it's a little easier on the floor. So you could try that.
Okay.
Okay?
Okay.
All right. So why don't you try that? And if it doesn't work, we'll try something else, okay?
Okay.
And by the way, I'll give you, I think you have that patient handbook still. There's a section in there on visualization, incorporating, into deep breathing. You can read through that.
Okay. Thanks a lot.
The next thing I want to discuss with you is something called coping cards. And coping cards aren't so much an intervention per se, but they're rather a tool that you can use with any of these interventions. And coping cards are basically little index cards that you can use that reinforce what you're doing with the patients. And when I worked as a nephrology social worker and wore a lab coat, I kept a bunch of sort of index cards in my lab coat. And whenever I was doing STI with my patients, I'd pull it out. And if I was doing a behavioral activation, I might write down their program on one side or write down something we discussed. Sometimes I'll draw a picture of the cognitive triangle. It basically just reinforced what was discussed during our time together. And with guys, sometimes I'll cut them in half so that they can put them in their wallet. So coping cards, again, are something that you can and really should use with any of these interventions, and the patients find them incredibly helpful.